Hi, everyone. Thank you for joining today. My name is Dr. O'Byrne, and I'm one of the physicians at Health Nucleus. And I am delighted that you have joined today to hear my lecture about sleep. So without further ado, we will get started. So again, the lecture today is going to be sleep, and the title is Powerhouse to Health. My name again is Dr. O'Byrne. I am a vascular and integrative board certified internal medicine physician. I received my medical degree from University of Medicine and Dentistry of New Jersey, Rutgers Medical School. And then I attended residency in internal medicine at the Cleveland Clinic Foundation and Hospital, where I also did my first fellowship in vascular medicine. And then later on in my career, I did another fellowship in integrative medicine at University of Arizona in their integrative program there. So our topic today is sleep. And this is actually Mr. Google's explanation of sleep. And you can see it's kind of a colloquial sort of definition, I suppose you could say. State of rest when our eyes are closed, the body is not active, and the mind is not conscious. But of course, sleep is really so much more than that. And today I'd really like to make the case and educate our listeners about the importance of sleep and how we probably should all be prioritizing sleep. But before we get started in that, I would like to make the comment that there has been a sea change really in the past 20 years about medicine's attention towards sleep. And I think when I went to medical school, and certainly when I was in residency, and even during my first fellowship in vascular medicine, there was really very little attention or focus on the physiology of sleep. And basically, we were taught that there were two types of sleep. There was REM sleep and non-REM sleep. And there was perhaps an hour lecture in terms of those two stages of sleep. And that was really about it. And it's really only been in the past 20 years or so where there's really been an explosion of information about the physiology of sleep and how important sleep is to our overall health. So these are some of the topics that I'd like to discuss today, and these are some of our outlines. So we're going to go over sleep basics, how sleep is generated, and we're going to talk, of course, about how sleep is very important to optimizing our health. And of course, at Human Longevity, that is what we're all about. We're going to talk about some sleep disorders, as well as insomnia, which is a type of sleep disorder. And then finally, we'll spend some time on some discussion on how to improve our sleep, which of course, many of us would like to know lots about. So of course, we spend about a third of our lives asleep. Human beings need about 7 to 9 hours of sleep with a little bit of toggle on either end there. But 7 to 9 hours covers the vast majority of us in terms of our sleep needs of time. And that need of sleep in terms of that 7 to 9 hours is really not negotiable over the course of a week. It turns out that you actually can't make up for sleep the way a lot of us perhaps maybe thought that we could. That idea of social jet lag and sleeping in on the weekends just doesn't quite cut it in terms of the physiology. So that's another thing that we will focus on. So in terms of the anatomy of sleep and how sleep is generated, there are multiple areas of the brain that's involved with this. First of all, there's a really important chemical that is produced during our wakeful time during the day. So most of us are awake about 16 hours in the day, and we generate a chemical called adenosine that builds up slowly over the course of the day. It's actually a byproduct of ATP metabolism, and that's energy metabolism that is generated by the mitochondria of all of our cells, including the cells in our brain. And this adenosine acts as a trigger or puts sleep pressure on the brain to initiate this whole pathway of sleep. And there are multiple different areas of the brain that are integrated together in terms of producing that sleep, as well as the sleep-wake cycles that we all end up having over the course of a 24-hour day. There's an interesting area of the brain, it's kind of termed the SCN, or suprachiasmatic nucleus. That particular area of the brain is actually part of the hypothalamus, which is a really tiny area way deep in the center of our brain. And that suprachiasmatic nucleus is also directly affected by the backs of our retina, so the back of the eye. So when the back of the eye actually gets light signals, it actually promotes that wakefulness part of our brain as well. And there's another area of the brain, the reticular activating system, that actually even sits below that area in the base of the brain, that produces a chemical called orexin that promotes wakefulness. But all of these areas are integrated together in this beautiful orchestra that regulates our sleep and wake cycles. Some of us are more familiar with the pineal gland. The pineal gland is predominantly tasked with the idea of producing a hormone called melatonin, which melatonin, again, many of us have heard of before. And melatonin is also really important in terms of sending that signal to the rest of the brain to get ready for sleep. Interestingly, there's actually more melatonin in the gut than there is in the brain. It just goes to show you how connected our body is in terms of integrative medicine. So I always like to kind of make that point. So there's two different types of sleep that and actually there's even more categories in terms of the non-REM sleep, but there's two big broad categories. One is rapid eye movement sleep, and that's termed REM. And then the other category is non-REM, and that is further subdivided into 4 subdivisions. So this goes back to the 1920s. And again, there was kind of a lull in terms of research on sleep for many years, really until the last 20 or 30 years. And we learned much more within the past 20 years, especially. So again, the rapid eye movement sleep, some of us already know that that's associated most predominantly with dream sleep, or at least very vivid dream sleep. It turns out that actually all of the stages of our sleep can be associated with some type of dream activity. But the rapid eye movement sleep is most predominantly with our most vivid and dramatic dreams. Non-REM sleep is associated with what we call deep sleep, and there's 4 different categories associated with that. There's an interesting misconception that many people have actually, where we think that the REM sleep is not quite as important as the deep sleep or the non-REM sleep. And actually that is absolutely not true. It turns out that both types of sleep are absolutely essential for both our physical health, our cognitive health, and our emotional health. It's true that it seems that our emotional health might be more dependent on REM sleep, and our restorative health might be more dependent on deep sleep, but both are actually incredibly important. And interestingly, years ago, in the 1960s, there were some animal studies done with rats where rats were deprived of sleep entirely. So when rats are deprived of sleep, and of course, luckily this experiment won't be repeated again for obvious reasons, but when rats are deprived of sleep entirely, they end up dying usually in about 9 to 10 days. If they're deprived only selectively of deep sleep, they usually will die between 18 and 20 days. If they are deprived selectively of REM sleep or rapid eye movement sleep, they again will die in 9 to 10 days. So it turns out that the REM sleep actually is more critical, at least in terms of rats, in terms of essential functions. So again, just kind of reviewing these different types of sleep and putting them into broader categories in terms of what happens. It's important to know that your body goes through a very orderly transition over time, and each cycle is about 90 minutes. And it always starts with being awake and then going through the 4 stages of non-REM sleep and then entering a stage of REM sleep. The first portions of the night have a minimum of REM sleep and majority of non-REM sleep. And then the second half of the night, that policy shifts a little bit, and you end up getting more REM sleep versus non-REM sleep. This can be important, of course, because some of us end up getting up early in the morning, whether it's because of school or whether it's because of some other type of social event like work or something along those lines. And we can end up cutting off the amount of our REM sleep pretty dramatically, because if you understand the physiology, you're understanding that the vast majority of your REM sleep is going to be in that second half of the night. And so if you have to get up early for a flight or you're getting up early for work, you end up cutting off that REM sleep, which again is so important for your physiology. So the sleep cycles, again, last for about 90 minutes, and they go through very organized sequential changes as the night goes on. So this stage, or this slide basically kind of goes through all those 4 stages as well as identifying the REM. And if you can see over the course of the night, you can see how the REM actually increases towards and the x-axis here is time, and you can see the REM actually increases as the night goes on, whereas in the short period or the earlier period of the night, the REM is actually much shorter. And the reverse happens in terms of the deep sleep stages. So physiologic responses to sleep are very interesting as well. The periods of REM sleep or rapid eye movement sleep where you have the most vivid dreams, this type of sleep is associated with almost psychosis or hallucinogenic type dreams. An important part of the physiology is there is an immediate disconnection between the brain and the upper areas of the cortex and the rest of the body, the voluntary muscle. And that kind of will make sense to you because your body certainly doesn't want to be acting out the dreams that you're having at that time. But there's autonomic nervous system activation, which occurs during these times as well. So in these charts, you can see that the unshaded areas are representing the REM sleep. And you can see an increase in heart rate during that time, increase in respiration, and even erections occur during that time in men. So this is a very physiologically active period of sleep during that active dream stage. What's also just interesting as well is some patients that have REM sleep behavior disorders, such as Parkinson's disease patient or Lewy body dementia patients, they actually will end up acting out some of the dreams. That cutoff between the upper cortex and the voluntary skeletal muscle has broken down, and there can be actually lashing out and a lot of movement, purposeful, it almost seems like purposeful movement. This particular disorder can predate the onset of neurologic disease by sometimes decades. So sometimes that's a tip-off, actually, that somebody might really be having a problem brewing in terms of one of those neurodegenerative diseases. So our brain waves during sleep are also really interesting. Again, these whole waves take place over about a 90-minute cycle. The alpha, beta, and theta delta waves of non-REM sleep are really super interesting and change over time, so that once you get to stage 4 sleep, which is considered the deepest levels of sleep, you have very high amplitude, but very slow frequency waves. And you end up having these massive waves of energy that end up going through the brain from the deeper portions of the brain up until the cortex of the brain. It's thought that these waves are actually, they function for many different reasons, but it's thought that they actually function to move memories from the short-term memory centers into the longer-term storage centers of the upper cortex. So some people have said that sleep is actually our baseline function, and it's actually the price that we pay for being awake. So that's kind of an interesting way of thinking about sleep and in terms of its importance. But there's many things that sleep do, and just a few of them are kind of mentioned here in this slide. So we can think of sleep as a way for our brains to actually move out molecules that are detrimental to our neurologic functioning. And it's important to realize, of course, sleep is a critical function of life, just like food and water and oxygen are. So those are kind of the four things that you absolutely need to live. Memory processing and retention is absolutely critical and is impacted by our sleep quality and our sleep length. There is absolutely creativity, which is developed during sleep. This, again, seems to be more tied into REM sleep. Emotional recovery, mental health, again, critically important. About 10% of the population really does suffer from real problems in terms of sleep disorders and insomnia. And that also happens to correlate about 10% of the population as having serious mental health issues at any given time. And that's not just a coincidence that actually is happening. One thing also that a lot of patients actually appreciate is understanding that the idea of hormone productions, especially growth hormone and sex hormones, things like that, is critically tied to the quality of sleep that we're getting. So for example, if a man is concerned about testosterone levels and perhaps his testosterone level is a bit low, if that person has not been getting adequate sleep or good quality sleep, it's actually probably a mistake to say that there really is a problem in terms of low production of testosterone. It might just be a function of that poor sleep. So this kind of just reviews all the different areas of the body that can be affected by sleep deprivation of any type. Everything from cardiovascular disease to really short-term incidents such as drowsy driving accidents, which cause a huge number, in fact, even more than alcohol-related accidents every year. Things in terms of cardiovascular disease, especially high blood pressure, which has been really closely associated with lack of poor sleep. Risk for diabetes, and we'll talk a little bit more about that in terms of the metabolic impacts of sleep. But basically, there is no body system whatsoever that is not affected by inadequate sleep. And that's a really important take-home point, I think. You can almost think of sleep deprivation or poor sleep for whatever the reason, almost like a broken pipe in the top floor of your house. And those effects end up just like the water would be affecting every single area of your house. Those effects are going to affect every single area of your physiology. So again, speaking of sleep as a foundation of health, it really is absolutely true. And we're going to focus on a couple of these things here a little bit more specifically. And starting off with metabolic disease. So many of us are somewhat familiar with this. Most of the time, what we're really talking about here is things like insulin resistance and diabetes or prediabetes. It's estimated that probably only about 12% of the United States population is metabolically really healthy. What ends up happening, apparently, with folks that are sleep deprived, again, for whatever reason, is we have a mismatch or kind of a dysregulation in certain hormones. One is leptin and one is ghrelin. So leptin is a hormone that is produces a feeling of satiety. So it sends a signal that we've eaten enough and we can stop eating. This actually goes contrary to the way it's supposed to go in somebody who's sleep deprived. Part of the reason for this is that a brain that has not been slept adequately is a brain that is stressed. And when a brain is stressed, it ends up doing things that is not exactly advantageous to the organism. But of course, it doesn't really know that. It just knows that it's stressed. And over time, you can imagine how these can cause a lot of downstream effects. Ghrelin actually acts in the opposite way. It's a hormone that is produced by your brain in response to hunger and the feeling that you need to eat more. And again, despite the fact that you might have eaten plenty of food, that hormone will be elevated in a situation where your sleep has been negatively affected. Cortisol ends up being very high in an underslept brain, causing sugar glucose to go high as well. And catecholamines are those adrenergic type hormones that we end up producing in sort of an episode of fight or flight that you may have heard of. Those catecholamines also produce problems in terms of blood pressure and cardiovascular disease. So specifically with cardiovascular disease, again, the issue is inversely proportional to sleep duration. Think of sympathetic nervous system activation, that portion of your autonomic nervous system that gets overstimulated in a situation where the brain is stressed. Other issues such as sleep apnea, which is a really common sleep disorder, which we'll also discuss again in a moment, is another problem that often occurs in terms of related to poor sleep, and metabolic syndrome as well, all the downstream effects of the metabolism impacting the risk of cardiovascular disease. Neurologic disease, we'll spend a little bit of time on that. We'll learn about the lymphatic system and what that actually does and how that's affected in terms of poor sleep and how important it is actually to brain health. And then immune function, we won't spend too much time on that, but of course, we're always concerned about the issue of cancer, and the links between cancer and poor sleep are not as well defined as some of these others. But what is very defined and what's been shown is that natural killer cell activity, which is absolutely really important in terms of surveillance of the body for cancer cells that have just begun to grow. So what is really happening with us really all the time is that there occasionally are cells that are malignant or cancerous. Natural killer cell activity is really important for hunting those down. You can think of those as kind of the reconnaissance cells of our body that really kind of go out and hunt those cells down and kill them. Natural killer cell activity, at least in vitro, in terms of tests that have been done, are impacted and are decreased by 70% in terms of their activity after just one night of really poor sleep, under 6 hours. We have also shown in really beautifully done studies how elderly adults, for example, if they have a poor night of sleep before a vaccine, just a flu vaccine, for example, will have a 50% decrease in the number of antibodies that they produce as a result of that vaccine. The impact is so dramatic, I would say, in terms of immune function, that I usually advise my patients that if you haven't gotten a good night's sleep before your vaccine the next day, I would reschedule the vaccine. That's how profound it is. Cytokine release is also really affected in terms of poor sleep. There's many more inflammatory hormones that are released, like IL-6, for example, in that situation where the brain is a stressed brain due to lack of sleep. So we're just going to go through a couple things in terms of some of the studies that have been done, metabolic impacts of sleep. And because this is so important, I like to think of the metabolism as one of those overarching or umbrella impactful situations where all the other age-related diseases can be impacted in a negative way. That's one of the reasons your metabolism is so important. So that impact of immunologic disease, cancer, ASCVD, as well as neurologic disease. So this was a really interesting study, and it was done in 2012, so a little while ago, but it was really a beautifully done study. So they took a number of patients who ended up serving as their own controls. They short slept those patients for about 2 weeks. And then they actually did fat biopsies on the patients and then were able to experiment on those fat cells in that situation where those patients were short slept for 2 weeks. And what they showed was that those fat cells had a decrease in their insulin sensitivity very dramatically, 30 to 50% in that short slept period of time. They took those same patients and they allowed them to sleep a normal 8 hours for 2 weeks. And they took those same fat cells and they examined them. Those fat cells were then normal in terms of their reception of glucose, and the insulin sensitivity had gone away. So again, just to kind of review the importance of metabolic dysfunction, as I mentioned, so neurodegenerative disease, ASCVD, cancer, and immunologic disease, all of those big buckets that we think of in terms of dysfunctional aging are impacted by poor metabolic function. And when you have something that even supersedes that, such as sleep, which directly affects metabolic function, you can see that sleep can directly affect these things as well as work through metabolic dysfunction itself. So we're going to move on a little bit now to neurodegenerative disease and sleep. So most of us will recognize the two individuals in this slide, Ronald Reagan and Margaret Thatcher. So these two were actually really good friends throughout the last half of their life, or at least the last third or so, and they kept in really close touch. So they were both, of course, very prominent world leaders, and they also used to compare notes and apparently were bonded by the fact that neither one of them really seemed to need a lot of sleep. And they used to actually brag about this quite a bit, about how they just didn't sleep and they didn't seem to need sleep, and they were workaholics and they were just really never sleeping. But what they also have in common is they both ended up dying of Alzheimer's disease. So Alzheimer's disease, of course, we're all pretty familiar with that. It's probably the most feared of all of our age-related diseases. And it seems to be more and more likely that a large component of Alzheimer's disease is actually a lifestyle disease. And sleep actually can dramatically impact the incidence of this occurring. So just a few other comments about sleep. Sleep deprivation, we probably all know, is definitely considered a form of torture along the world or around the world. The Supreme Court of India has said that the right to sleep is a fundamental right of citizenship. Now, there are a few people out there with a DEC2 gene mutation. It's way, way less than 1% of the population, because you always hear that some people really do claim that they really don't need to sleep a lot. This is a very rare phenomenon, but there actually are people that seem to be incredibly efficient, deep sleepers at least, but they don't seem to get quite as much REM sleep as at least the rest of us seem to need. And the studies are actually still ongoing as to whether or not these folks are really going to have increased levels of neurodegenerative disease or even increase in emotional problems as well. But in any event, the vast, vast majority of us need 7 to 9 hours sleep to maintain our health. So sleep and neurodegenerative disease is kind of an interesting topic because as we get older, our sleep needs do seem to change somewhat. And there's also a pretty close correlation between neurodegenerative disease and issues with sleep and complaints about sleep. So there's always a little bit of a problem in terms of chicken and the egg and what exactly is going on there. Now, there is absolutely correlations and associative correlations as well between beta amyloid as well as tau. So REM sleep behavior disorders, as I mentioned, and the links to Parkinson's disease is important. But getting back to the issue of beta amyloid and tau, it's important to kind of understand that these proteins that we've probably heard about, especially in terms of in terms of Alzheimer's disease, they have not been proven to be causative, but they seem to be absolutely necessary for the occurrence or at least the diagnosis of the disease of Alzheimer's disease, and especially phosphorylated tau, for example. So the buildup of these proteins can reach a level of almost toxemia is probably the way to think about it. And they are normally occurring. So everybody actually produces these proteins in their brains. But one of the functions of sleep is actually to wash these areas away. And that's really what we're talking about in terms of the glymphatic system. So the glymphatic system is something that is really has been very newly discovered. So this came out of the University of Rochester in 2012, and they were able to show that our brains have a waste clearance system that is mediated by the astroglial cells. And you can think of it really as a plumbing system in our brain that promotes the elimination and clearing of all kinds of toxic metabolites that we naturally generate every day through the functioning of our neurons, as well as astroglial cells. So it really does promote this whole idea of elimination and clearing, and it works during deep sleep. So the way this apparently works is the glial cells, which are glue, you can think of them as the glue, it comes from the Greek word glue, end up shrinking. So during deep sleep and during those large waves of slow frequency that goes through your brain during the deepest phases of sleep, phase 3 and phase 4, you end up having a shrinkage of those glial cells, which makes room for the fluid, the CSF or the cerebrospinal fluid, to wash through the brain and wash away the brain's waste products. So it's an incredibly important system. And it doesn't really take a lot of imagination to see that if somebody is not getting adequate sleep, there is just not this opportunity to wash away this type of byproduct. And again, when we talk about beta amyloid as well as tau, we are talking about protein products that are necessary. Perhaps they're not sufficient on their own, but they're necessary to be producing a tauopathy such as Alzheimer's disease. So this was kind of a really classic study that's been quoted many times. So I thought that I would just mention it here. This was a study that looked at human beings, and they were completely deprived of sleep. So it was 20 people, and they deprived them completely of sleep. And they ended up doing PET scans on these folks, as well as tapping their cerebrospinal fluid. And they were able to show that after one night of zero sleep, there was an increase in the amount of beta amyloid as well as tau in these folks. Now, there was also a really interesting part of this study that came out because these researchers they also looked carefully at ApoE4, which is a genetic genotype that we test for at Health Nucleus to see whether or not somebody might have a genetic predisposition or a genetic marker, that it can be a strong marker for the occurrence of Alzheimer's disease and neurodegeneration. The ApoE4 individuals in this study actually had a more diffuse distribution in terms of the amount of the amyloid that they ended up depositing in their brain after that one night of no sleep. I personally think that one of the problems that we have in terms of discussing sleep and whether or not people are getting adequate sleep is that we don't have a really clear biomarker to test for this. So if you think about it, for many other physiologic functions, whether it's cardiovascular disease or even whether it's metabolic disease, we have lots of tools to see whether or not somebody is really doing pretty well. we have got calcium, coronary calcium scores, for example. We've got cholesterol measurements that are easy to track. We've got hemoglobin A1C. We have insulin resistance scores. So we've got multiple ways to see how healthy somebody is. One of the problems, of course, with sleep and all of the downstream functions associated with sleep in terms of our physiology is that we don't really have a very good biomarker for sleep. But I actually think that over the next several years, we're going to be using serum tests that will test for amyloid, the 40 to 42 ratio, that might actually give us a lot better information as to whether or not that particular person is getting adequate sleep for them. So again, to kind of finish up in terms of a little bit of science here, this is just the last study that I wanted to mention. It was done, more recently. And as we said, Alzheimer's disease is the most famous of the tauopathies in terms of the accumulation of amyloid as well as neurofibrillary tangles based on the tau protein, phosphorylated tau. In this particular study, they ended up checking for in mice as well as humans with short sleep over a short period of time. And they were really able to show that there was a 50% increase in the amount of tau in the CSF in a group of human beings that were deprived of sleep over a period. So we're going to move on a little bit now. We're going to talk about the 4 pillars of optimal sleep. And I'd really just kind of like to make the point that what we're really talking about with this lecture is not necessarily for all of us to strive or to become anxious because perhaps we're not getting our optimal sleep every single day. What we want to do is optimize our sleep, as this is not an all or nothing phenomenon. So in other words, if you really do feel that your sleep could could use some improvement, and you're able to make some changes in the way that you live your life, for example, and you make those improvements over time, even if it's not perfect, you are going to be getting a lot of benefit from that. So the 4 pillars of optimal sleep are regularity, that's consistency of your sleep schedule. There's continuity, and that's being able to stay asleep during the majority portion of the night. That has to do with perhaps sleep interruptions, and we'll talk a little bit more about that. The actual quantity of sleep that you're getting, that has a lot to do with your sleep opportunity and whether or not you're actually allowing yourself to have that sleep opportunity. And then there's the quality of the sleep, which is really important as well. Sometimes that actually can be negatively affected by certain drugs or even medications that we're taking. Oftentimes we're taking an antidepressant, for example, or maybe we're taking something for ADHD. That can also impact the quality of our sleep. And then, of course, the other side of the coin is what other types of medicinals might we be taking to, use as sleep aids, which actually can impact the quality. So just talking a little bit more about the idea of insomnia and sleep disorders. So first of all, there are a couple different types of insomnia, and insomnia is just a very common sleep disorder, although it's probably not the most common sleep disorder. The most common sleep disorder is probably a sleep apnea type of disorder. But insomnia is a word that we use, and it can mean different things to different people, but it is kind of important to kind of understand what insomnia truly is and divide it into different categories. So some people have problems in terms of sleep onset. That's kind of the classic situation where somebody is taking longer than 30 minutes to go to sleep, and there's a lot of tossing and turning before sleep actually occurs. There's sleep maintenance. That's where there's multiple interruptions in the sleep, and there can be real problems in terms of getting back to sleep. Again, another 30 minutes or so to get back to sleep. And then there's the issue of sleep quality. So even though there seems to be enough sleep, the person does not feel really refreshed when they get up. which we certainly should. Sleep disorders, narcolepsy is not too common, but it certainly can occur. These folks can go from being completely awake and seemingly very functional, and then actually immediately go into REM sleep, and it can be very dangerous for them, because they can actually be, walking around and just suddenly go into a deep sleep, including a REM sleep. Obstructive sleep apnea is probably, as I said, one of the most common issues in terms of sleep disorders. It's usually obstructive, although there are other sleep apnea occurrences, other types that can occur. It's associated with male sex, age, being overweight, obesity, of course, as well, and also with snoring. It's probably the least diagnosed of the serious sleep disorders. And apnea, of course, means lack of breath. So this means that these folks end up having periods of time during the night where the oxygen saturation of their blood can go way, way down into a dangerous level. This is incredibly stressful for your body. If this happens multiple times during the night, it causes cardiovascular disease, it causes hypertension. It can cause fatal arrhythmias. So it's an important diagnosis to make if it's there. And if there are things that can remediate it, they should be pursued. Restless leg syndrome is another sleep disorder, which is fairly common. Probably between 3 and 5% of the population at any one time has this. So restless leg syndrome is it's a neuropathic disorder where there's an irresistible urge to kind of move the legs, especially when you settle down and go to sleep. Sometimes it can be associated with iron deficiency anemia, or even iron deficiency of the brain itself, which can be remediated by supplementation with iron, for example. And then finally, REM sleep behavior disorder, which I had mentioned earlier. That's where somebody is actually physically acting out some of the dream behavior, which is always pathologic and oftentimes can predate the occurrence of Alzheimer's disease up to a rate of 90% predictive of eventually developing neurodegenerative disorders such as Alzheimer's and as well as Parkinson's. Fatal familial insomnia is luckily very, very rare. It's a genetic disorder. The genes have been evaluated for this. Luckily, it's incredibly rare to find this. And these unfortunate people have this occur around middle age. And over a period of 18 months, they end up completely losing the ability to sleep, and it is always fatal. So there's a lot of question about whether or not somebody truly has insomnia. So the definition of insomnia for a medical profession might be different from our kind of colloquial understanding of insomnia. But basically, if somebody has at least 3 days a week where they take at least 30 minutes to get to sleep or 30 minutes to resume sleep if they've woken up during the middle of the night, and this has been going on for at least 3 months, they would qualify for a diagnosis of insomnia. However, the ability to generate sleep and stay asleep, which would be sleep ability, is different from sleep need, and that's different from sleep opportunity. So oftentimes these things kind of merge together, and you really do find people that have problems with their ability. They have problems giving themselves the opportunity, and they also need the sleep. So you can see how when there is an issue with sleep, you have to sort these things out. Oftentimes when somebody is not getting enough sleep, it may just be simply that they're not giving themselves the sleep opportunity, that they're not actually prioritizing sleep the way they should. And so that is very different from having an inability to generate good sleep. And then same with the need as well. So if there really is a problem with sleep deprivation, it has to be affecting the person in some type of physiologic or physical way, as well as perhaps affecting their mental health. or their cognitive functioning. So one of those three has to be affected for there truly to be a problem in terms of sleep deprivation or even insomnia. So we had mentioned earlier that there's an important chemical that our body generates that starts that cascade of events that ends up in sleep. And that chemical's name is adenosine. So that's a really important chemical that naturally is produced by all the cells of our body as our day goes on. Caffeine, of course, we're probably all really familiar with, but caffeine ends up blocking the effect of that sleep molecule adenosine. And that's the way caffeine works. It keeps our bodies kind of artificially stimulated. Caffeine is one of the most common problems, actually, of poor sleep for some of us, because it has a pretty long half-life. It's got a half-life of around 6 to 8 hours for most of us. However, some of us actually have a certain pathway in our liver where we're kind of a little slow in terms of breaking caffeine down in our body. So even 12 or even 16 hours after we've had that last cup of coffee, we can still have the effect of the caffeine, blunting the effect of adenosine to start off that sleep signaling. Alcohol is another really common problem in terms of sleep disorders. It is renowned actually to cause fragmentation of sleep and even an unknowing fragmentation of sleep. So a lot of folks are not even necessarily aware that the alcohol has actually impacted their sleep to such a degree. But the fragmentation of sleep and having sleep never quite go down as deep as we need it to go can be very deleterious. Again, if we remember a few slides back, how important that stage 3 and stage 4 sleep was to clearing out those toxic molecules from the brain. So you can appreciate certainly how something like a sedative or a hypnotic, which is what alcohol is, could actually blunt the clearing of all those toxic molecules that we definitely want to get rid of. Now, there's other classes of medications. Nicotine, for example, is a stimulant. It will cause like an adrenergic type of activation, activate that sympathetic nervous system that can really affect our sleep as well. And talking specifically about sleep aids, sedative and hypnotics include a lot of drugs that we've probably heard of, such as Ambien, for example, and Ativan and Lunesta, as well as alcohol. They all actually fit into that sedative hypnotic type of category. These types of drugs, it's kind of interesting, for at least the Ativan type, and the Lunesta and the Ambien, those drugs have been looked at now for really many years. There's a great researcher out of UCSD by the name of Cricky who ended up doing some epidemiologic work on the use of those drugs. It turns out that they have a very profound interaction in terms of your longevity as well as your overall health. And he found that only using 3 to 18 of those pills per year actually will decrease your longevity. So it's kind of an interesting point. And the way that happens is actually through impacting your sleep, as well as perhaps short-term impacts in terms of accidents. THC is an interesting molecule as well as CBD. It's gotten a lot of attention in the past couple of years as to whether or not it could be a sleep aid. The bottom line with this is that I think the research is not very clear. And it's recommended that these things could be used for very short periods of time with perhaps less of a negative impact compared to the benzodiazepine class or the sedative hypnotic class. But probably it's not wise to be using these chronically, actually at all. They tend to have a pretty severe rebound effect once you begin to stop those medications, especially with very vivid and sometimes disturbing dreams. So how to improve your sleep? This, of course, could be a lecture unto itself, but I definitely want to spend a little bit of time on this. So this slide, in terms of the most important things here on this slide, in terms of how to improve. So the idea here really is sleep hygiene. So this is kind of building the framework around your optimal sleep and figuring out how to get it. I guess if I had to pick out, they're all important, but I guess if I had to pick out maybe some of the most important things, um, it could be the sleep hygiene issues of the darkness of your room, the temperature of your room, how consistently you are making yourself get up the same time every day can be incredibly important. Making sure you're giving yourself the sleep opportunity to prioritize sleep. Stimulus control is really important as well. So oftentimes what many of us will do if we're having problems in terms of sleep interruptions and we're getting up at night, we're going back to bed and we are trying to get back to sleep for too long a time. So the rule of thumb, for example, is that you can certainly try and go back to sleep if you've gotten up to urinate or if you've just woken up for some reason for maybe 15 or 20 minutes or so. But once that time has gone by, you need to get out of bed and you need to go somewhere else. You need to listen to quiet music or do some relaxing breathing or read a book. And then once you're really tired, go back to bed. So our brains are very associative organs. We tend to associate, even if it's subconsciously, certain places with certain activities. Your bed really only should be for sleeping. And if your brain begins to associate your bed with laying there being awake, that really is what you're going to be doing. So that pattern definitely needs to be broken. Discovering your chronotype is kind of an interesting thing. Most of us end up being kind of in the middle. In other words, we're not particularly prone to go to bed very late, and we get up, fairly early, but not particularly early. But there's about a third of us that really have a very strong genetic tendency to be a night owl and stay up really late, or a lark and get up really early. It's very difficult to actually change these genetic tendencies with any kind of environmental manipulations. You can change it a little bit, but it's actually really difficult. These folks that are on the extremes, especially the real big extremes, which is about 5 to 10% of the population on either end, really have a hard time in modern day society, actually, because the rest of us tend to kind of be more in the middle, and we do kind of get up on the earlier side, but we don't stay up too late. But again, these folks have a lot of trouble adapting themselves and suffer from high rates of depression, actually, and mental illness. Meal timing can actually be really important. So I mentioned earlier in the lecture how there's more melatonin in your gut is in your brain, even though it's considered a brain hormone. Your gut and your brain are intimately connected. So meal timing can be a really useful tool. You need to put your gut asleep, and basically that means no food about 3 hours, or even 4 is even better, leading up to the time when you would normally go to bed. So that's kind of a strict rule that you should have if you really want your best sleep. Room temperature and darkness, I mentioned. Your temperature in the room needs to be about 65 to 68 degrees. It shouldn't be any warmer than that. Your body needs to actually cool down to begin that parasympathetic drive of the autonomic nervous system that will promote sleep. Darkness is incredibly important. Make sure that there's no glowing lights, there's no clock faces that are facing you, nothing like that. Caffeine and alcohol, I kind of mentioned in terms of the impacts on sleep itself, but there's another important impact of caffeine and alcohol, and that's its effect on the ADP enzyme. So we have a hormone that's actually produced, it's called ADP, and that particular hormone is great because it ends up concentrating our urine. But both alcohol and caffeine will act enzymatically, and it will block the effect of that concentration of the hormone on our effect of our urine. So one thing that folks can do, and sometimes it's an easy trick, is to make sure that caffeine and alcohol are nowhere near close to bedtime at all, so that they don't have any effect of that in terms of getting up and needing to urinate. Limiting evening time fluids can actually be really helpful as well. So some people end up just drinking a lot of water, tea, or whatever in the evening, and they end up kind of artificially interrupting their sleep when they really didn't need to. If you can drink a couple liters of water during the day and then limit your fluids leading up to bedtime, it can really help. Getting natural sunlight in the morning first thing can be very helpful in setting those wake sleep cycles so that your body and your brain really does get accustomed to the normal flow. And then lastly, for people that really do have the clinical diagnosis of insomnia and have some really real big challenges with that, cognitive behavioral therapy for insomnia is a proven technique that really can only be 6 or 8 sessions with somebody who is competent in this area to really make a dramatic life change in terms of their sleep quality going forward. So I would certainly encourage exploring that. I wanted to say a little bit more about that, cognitive behavioral therapy. These are the broad topics that are discussed during all of the sessions in terms of that therapy, which again has been proven to be really efficacious for many people. There's 2 important websites here that folks can go to: sleepeducation.org as well as behavioralsleep.org. There's tons of great information about sleep on both of those websites, and all kinds of great resources that you can explore. So I want to thank everyone for attending. This has been great. And I'm going to turn it over now to Megan, and we will take a few questions.
Thank you, Dr. O'Byrne. So we have some few questions. To start, it looks like we have some questions pertaining to certain drugs and how they affect our sleep and our deep sleep. So first question, can you comment on the long-term use of Benadryl as a sleep aid?
Yeah, so Benadryl, that's kind of interesting. First of all, there's not great voluminous data on it. I'll say that. But the data that seems to be out there indicates that Benadryl is somewhere in the middle. So, for example, if you want your best sleep, you don't use medicinal aids at all, with maybe the exception of melatonin, which can be used for sleep scheduling. So that's kind of your best scenario. You're really not using any medication or any kind of over-the-counter anything. And then the worst case scenario is when you're using things like benzodiazepines. So the link with premature death, as well as all kinds of negative, even cancer, for example, with benzodiazepines, the data is just terrible. So that's kind of on the other extreme. Benadryl for short-term use, I think is somewhere in the middle. So for example, if somebody is really having a hard time, maybe they're under a lot of anxiety, maybe they're, kind of just in a bad situation. They've had several nights of some struggle, with sleep, and they've done a few things, but it hasn't worked. I don't think there's any harm really in taking Benadryl. I think there probably is some impact on the actual structure and anatomy of the sleep that is so important, but I think it's minimal or moderate compared to some of those other alternatives. So for short-term use, I think it's probably reasonable.
Okay, great, thank you. And then there's also modafinil. What is your opinion on modafinil and the effect of sleep?
Yeah, so that's kind of really interesting class of drugs as well. I have not had a lot of patients that have been using that. I think that same type of thing. I think the data is, and to be honest, a lot of this sleep data is like evolving as we speak. And certainly like every year we're going to be learning more and more about, so many of these medications, as well as optimal physiology for sleep. And the bottom line is, with all of these drugs, you're better off without them. And that's that's really one of the take-home points that I think is really important. I think a lot of us tend to, use medications, and we need to understand that we should be using them very sparingly. And if we have to use them, we will, but there's a lot of alternatives that we can do. There are just so many things just in the sleep hygiene realm of things that we can do, that we absolutely should do before we resort really to any of these medications.
Could any of these medications have the reverse effect on sleep? So let's say if I overuse NyQuil, could that keep me awake rather than help me sleep?
Well, Benadryl has an interesting kind of paradoxical effect on some people at some time. So, for example, it's not even necessarily consistent with everybody all the time, but there are some people that can take Benadryl that end up having an adrenergic response, which is not what you would want at any time taking Benadryl for sleep. So, the answer to the question is yes, you can have things like that. And you can also have rebound effects, which can be really difficult. So, for example, for folks that are habituated to taking things like Ambien or any of the Lunestas or Ativan or Xanax or anything like that, there can be some pretty dramatic rebound insomnia that occurs when folks try and get off those medications. And interestingly, THC has now become pretty renowned for that as well. So for those of us that might have been using THC, because it does have an initial sedating effect, if you try and get off the THC at night, oftentimes there's some real difficulty in that, and there seems to be some dysfunction of REM sleep as a consequence, which can be really problematic, really bad nightmares people will have. Eventually it'll go away. So you can go through it, but it's not pleasant.
Okay, thank you. It looks like we're getting a lot of questions about the Aura Ring or other devices that are monitoring sleep. Do you do you believe that these devices can be helpful to gauge how well a person is sleeping?
Yes, to a certain extent. So the Aura Ring, I'm a fan of the Aura Ring, and I have one, although I'm not wearing mine right now. But I do have an Aura Ring, and I think it's helpful. One of the reasons I favor the Aura Ring over the watch is just anatomy. So the Aura Ring obviously fits on a finger. You've got two digital arteries that come out from each finger, from the proximal end of the finger to the end on either side. The Aura Ring has sensors that will actually pick up that digital signature of the oxygen and even oxygen saturation. So it'll pick up pulse as well as oxygen saturation. To me, that's pretty useful, and I also think it's pretty reliable. Now, the Apple Watch sits in a different part, obviously, of our wrist. It sits right on the top. The arteries for our wrist are on the underside of the wrist. It's always been a little bit mystical to me how the Apple Watch actually can give similar data compared to the Aura Ring, just because of the physiology and the anatomy. One of the reasons I like the Aura Ring is because, as I mentioned, sleep apnea is such a common problem, and it's a serious problem. The Aura Ring will actually give you tip-offs as to whether or not there's any significant periods of oxygen desaturation as you're sleeping. So part of the app will show that. So I think that is not an absolute in terms of diagnosing sleep apnea by any means, but it can give hints as to whether or not that could be there. So that's one of the reasons I favor the Aura Ring over the Apple Watch.
Okay, great. It looks like we're also getting a few different questions on regarding when we sleep in the day. There's one question on, is napping does napping have positive or negative side effects when it comes to sleeping? What about if I sleep during the day more than at night?
Well, yeah. So this is a common question too. So the bottom line with naps is that if you are habituated to naps and you take a nap in the afternoon of say 2 hours, and that's your normal siesta time, I think physiologically that turns out fine. Generally speaking, you would not want to nap sporadically if you can help it. So every time you nap, you're actually releasing and clearing out a lot of that adenosine that we mentioned before. And so you're kind of washing away that sleep pressure that you really do need to get a decent night's sleep later. So the sporadic nap doesn't work out very well. The habitual nap with a shorter sleep time, usually at night, seems to be fine, is the answer to that.
Okay, great. So I know you mentioned that natural light can help you fall asleep. So what if I wake up at 5:30 and when it's still dark? Should I adjust my wake up time to coincide with natural light?
Yeah, well, that would be ideal. That would be ideal for most of us, is to kind of get up and get some natural light like immediately. And even, either be looking out of a window or even go outside if you can. Now, a lot of this is very individual. So there are some people that are just very early risers and they get up before dawn. It does not necessarily mean that you're sleep deprived or you're really having a problem with sleep, just because you tend to be a really early riser. That should correlate with being someone who naturally is inclined to going to bed on the earlier side. And so if that's the case and you're getting enough sleep, you're giving yourself enough sleep opportunity, there's really no problem with that.
Okay, great. What are some foods or supplements that you would recommend to help us fall asleep and have restful sleep?
Um, Foods. Well, it's kind of interesting. The best sleep is really sleep on an empty stomach. And so I kind of made that point, and I think that that's a good take-home point. So to really get our best sleep, our stomachs and guts kind of need to be somewhat empty. And so fasting at least 3 hours before you go to bed is a really nice, easy trick. If you can do that, and it will actually really help. Your gut really does need to go to sleep. If your gut is sensing that you're still eating kind of right up to bedtime, it simply doesn't release the chemicals and the melatonin, frankly, that ends up affecting your sleep-wake cycles and will promote sleep. So generally speaking, you don't want to be eating things moving up into sleep. Now, in terms of supplements to help with sleep, so for example, if somebody has jet lag, and they're coming from one time zone to the other, I think melatonin, it's a maximum of 5 mg tablet. Better is probably 3. No more than 5, though, can help with sleep scheduling and jet lag. So melatonin is not going to really put you to sleep exactly or even keep you asleep, but it can help sort of readjust that signaling if you're going from one time zone to another, to actually get you into the right time zone, because it can start to spark off that pathway. Even though it's for you, it might be a little artificial, but it'll kind of help you get going in terms of that sleep schedule that you want to get back on. Other things that might be helpful in terms of like a supplement type thing that I might recommend, hops is one, and the phosphatidylserine is another one that can be somewhat helpful as well.
We have a question about magnesium. Would you suggest that as helpful?
Yeah, I think magnesium can also be helpful. There's some evidence, and certainly anecdotal for a lot of people, that it can sort of act as a soporific type of molecule. Progesterone also, especially for women, can be helpful at night. It can make people a little bit sleepy. So those things I think are very benign and great to try, especially if the progesterone is appropriate. Those things can help, and they should be taken kind of in the evening to sort of assist in terms of transitioning into sleep. And I would like to sort of say a little bit more about that. The pre-sleep routine that you develop in terms of part of your sleep hygiene can be really important. So you want to wind down. You want to take at least 45 minutes or so before your bedtime to actually wind down into sleep. For some people, that might mean a shower, a hot shower, or a hot bath. It might mean some meditation. It might mean some breathing exercises, just something to sort of get you into that routine of winding your body down, kind of calming down your sympathetic nervous system and being ready to go to sleep.
Great. And then do you mind repeating those two supplements you mentioned? Was it OPS or OPS? And then
HOPS, 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 and phosphatidylserine.
Okay, great. And then it looks like we have a few questions about jet lag, which, you know, you kind of touched on earlier, but do you have any general recommendations for someone, you know, who's, you know, flying overseas? Any suggestion to kind of that?
Right. So, you know, it's a huge challenge, actually, I think, in kind of our modern society, where there's a lot of international travel, or even just travel within the country through different time zones. It's a huge trial trying to optimize your sleep in that kind of situation. But it is important to do the best you can. And the rule of thumb is you can use melatonin in that situation to kind of help your brain adjust to the new schedule, but you should do whatever you can to sort of adjust yourself to the time you're going to. And so, for example, if you're flying, you know, from somewhere on the East Coast, for example, and you're flying to the West Coast, you would not necessarily, even though you might not have gotten good sleep that night because you took a red eye or something, you would not let yourself necessarily sleep in the next day to try and make up for the sleep. Believe it or not, that is not what you're going to do. The long term, you're going to be much better off if you stick to your schedule. And if you're used to getting up, and your normal schedule is getting up at 6:30 in the morning on the West Coast, you're going to do that. So even though that day you're not going to feel great, you're still going to do that, because the longer term adjustment and the quicker adjustment will happen that way.
Okay, thank you. And then another question here. Is it possible to ever get too much sleep or oversleep?
Well, I think that well, let's put it this way. There are people that might think that they're sleeping too much, especially post-COVID. A lot of us that ended up getting COVID had a lot of trouble in terms of fatigue and what we might call hypersomnolence. And there are folks that ended up having long COVID or effects of COVID that really did last quite a long time, that ended up seeming to need inordinate amounts of sleep. But that is different. And the reasons for that is that the immune system is very dependent on sleep for proper functioning. And when your body is challenged by a disease or some type of infection, whether it's viral or something else, oftentimes your body will respond by this overemphasis on sleep. So that is not necessarily pathologic at all. And so many times when you hear about people that are sleeping a lot, it's not that they're sleeping a lot in a pathologic way. They're sleeping a lot as a compensation for the fact that their bodies are physiologically still being stressed, or their brain is still being stressed. It's very, very rare that somebody actually has true hypersomnolence. And I don't think it's really even worth discussing. There's just so many people that actually are underslept, either because of the social demands of our life, or the work demands of our life, or the school demands of our life. That's really the problem that we have in today's society, is not prioritizing sleep the way we really need to.
Okay, thank you. And then just one last question, if you don't mind, spelling that second supplement you recommended, the bio, it was like a long word, biofilene or something like that for
With
the,
phosphatidylserine.
yes.
Yeah, I'm a terrible speller. Okay, I'm probably going to spell this wrong, but PHOSP phospho
Phos-
phosphatidyl serine. There's a Y in there.
Phosphatidylserine.
Phosphatidylserine, yeah.
Okay, I found it. Yes, I looked it up. Okay, awesome.
Okay.
Thank you so much. Yeah, I'll send that out to the attendees.
Yeah, and by the way, you know, for anybody who's listening, in terms of supplements, generally speaking, you're better off if you can buy them in Europe. Europe tends to regulate their supplements a whole lot better than the United States do. So if you buy it in Europe, you'll at least be somewhat assured that what you're buying is in the bottle at the dose that you think you're buying it. And otherwise, if you're buying something in the United States in terms of supplements, make sure that you're checking it with a third-party verification system.
Okay, I think that covers most of the questions.
Okay, well, great. Thanks everybody for attending. And I appreciate it and have a great night's sleep tonight.
Thank you so much, Dr. O'Byrne.
Okay.
Bye-bye.